You don't have to spend your life for the next 25 years working in a miserable environment of doing medicine the way that you don't want it to be done. You can have a choice. Just like you chose the specialty that you went into for being a physician, you can have a choice about your future. What is this fix for burnout? I would argue that your fix for the burnout is to create options. You need options. If you don't have options, if you don't feel like your future is going to be brighter than your past, this is when depression starts to kick in. When you think that all the good days are gone, like, I used to have this elderly gentleman that I hung out with, and all he could do was talk about how better the past was. And he was always infinitely depressed. It was miserable to be around. Well, if you don't feel like your future is brighter than your past, it's really hard to have energy and focus, and it's really, really hard to be excited about what the future holds. So there is a better future for you in medicine, and it doesn't have to be in insurance. You don't have to continue to play by their rules. You can have control over the money that you make. You can have control of your time again. You can have control over the types of patients that you see. You no longer have to abide by the rules of the industry that have been forced upon you. You don't have to do it. You don't have to be another statistic. You don't have to spend your life for the next 25 years working in a miserable environment of doing medicine the way that you don't want it to be done. You can have a choice. You can have a choice. Just like you chose the specialty that you went into for being a physician, you can have a choice about your future. Your future doesn't have to be dictated to you by some suit at the hospital or some techno-bureaucrat sitting in a cube somewhere in the insurance company. Patients are as fed up as you are with the insurance game. In fact, as a patient, I'll tell you, we're even more fed up, because you want to know what's happening to us? This year alone, they have, in many cases, and a lot of my friends are business owners. We provide health insurance for our employees. We're seeing anywhere between an 83% to 118% increase in our insurance premiums that we pay for our employees. And you want to know what? They're reducing coverage. Not only are they jacking our rates by some cases 2x, by doubling them, they're reducing the amount of coverage that we provide for our employees. And we're fed up. We're absolutely fed up. I'm in a group of nothing but founders and CEOs of people that own their own companies. And this is what's going on in the Slack channel right now. There's an entire Slack channel dedicated to it. So if you think you're frustrated, we're all looking for options, because many families are now having to spend $10,000 to $15,000 out of pocket before anything kicks in. There's plenty of patients out there. There's plenty of families out there that are already paying out of pocket for sub-level care, and they want options. And so we see this time and time and time again. You no longer have to be part of the system. You can get out. Hope you liked this. If you did, give us a big thumbs up. Share this with other friends. Rate us, give us 5 stars, subscribe, give us a thumbs up on the video, whatever it is, and come back and listen more. This has been Matt Galogli. This is the Practice Profit System podcast, and we look forward to talking to you soon. Have a great day, everybody.